Is this a big number under ordinary circumstances?
Thank you very much, Trevor, and good evening to everyone. So I think one of the things to remember about ICUs is that other diseases did not go away to give room for COVID. So even if there are ICU beds, there are other patients who are currently occupying these beds. So comes in this new disease that is taking up a significant number of beds. Over the last few weeks, we've seen an increasing number of severely ill patients. And if you have that pressure, if in Nairobi alone you have tens of people requiring ICU, it means that in a short while you will have all the beds full. And when you have severely ill patients, you will not have room to admit them into the ICU. So the other issue is that people don't go into an ICU bed for one day. They're going to be occupying this bed for several days. So if you keep admitting more and more severely ill patients, it means you don't have room for other patients. So as time goes on, if we have increasing number of cases, then we are going to have serious pressure for beds. And remember, if someone requires ICU and they're unable to get that bed, then we are facing the reality of death. So those are things that we have to think about.
So when you say that there are now more severe infections, and the CS had mentioned that it will get to a point where there's no movement of patients from one county to another, what would that then mean for specific counties where the surge is extremely high? Will you then decide who gets to be admitted, and on what parameters will you base that decision?
So to admit a patient into ICU, what we are looking at is how severely ill they are. So if they're on oxygen and they're not able to get enough oxygen into the blood, then it means the next thing we need is to put them on a ventilator so that we can help them to breathe. At this point, if a patient doesn't get an ICU bed and we are not able to ventilate them, then we lose that patient. The issue about transfer from county to county, if you remember at the beginning of this epidemic, we sort of asked every county to have some level of preparedness, to have enough isolation beds, to have enough beds with oxygen, and to have enough ICU capacity. So all the counties are going to be stretched, and every county will sort of be taking care of its own resources and making sure it has enough for its own people. So every county really has to prepare and has to ensure that they have enough capacity to take care of the very ill patients.
Would you say this is the tipping point? Are we at the peak of infections, or is this likely to rise even further?
It's highly unlikely that you're at the peak. With what we're seeing, with the rate of spread that you're seeing, it's more likely that you're going to see increasing numbers. And if what people are doing is any indication, if you continue to have rallies and other public gatherings, then the rate of spread in the community is going to be higher. So it's likely that we are far from a peak, and the peak is yet to come, which means we have to prepare for an increasing number of cases. The only way to avoid an astronomical rise, not to have too many cases, is for people to start taking the measures that were announced seriously. If everyone would wear a mask, and importantly, if we didn't stop the public gatherings, if we'd stop the political gatherings, if we'd stop having, large funerals or other functions, and that's the only way we can save ourselves. So we have to do things differently if we are to survive this.
So the CS picked out 3 hospitals which he says are now full and are not taking even any more patients. Do we have any available ICU beds now as we speak?
So that's a difficult question. Most of the hospitals in Nairobi have the COVID ICU beds prepared. Remember, not every ICU bed is available for a COVID patient, because we also have other patients who need those beds. So maybe there are other hospitals like Kenyatta University that may still have beds, but most of the major hospitals in town, when it comes to ICU capacity, are already stretched.
And Dr. Lois, every day we are seeing the deaths increasing. Would you say, is this because of rising infections, or is this a more severe second wave?
It's probably because of the rising number of infections. Remember, with COVID, there's always a small percentage, probably about 5% of patients who will be critically ill, requiring ICU, critical care, and ventilation. So as we increase the number of people who are infected, we are likely going to see a higher number of people who require ICU admission. And with that, we'll have a higher number of people who die because of COVID. So it's not so much that you're having more severe forms of disease, is that we're having more people infected. And if you look at the counties, remember in the initial stages of this disease, it was largely confined to Nairobi, but now it's moving more into the counties. And we have to be worried when this starts to move into the counties, because many of our older people who may be at higher risk may live in the counties outside of Nairobi and Mombasa. So the movement in the counties is worrisome, and counties really have to do something to stem this rise in cases. This is a point where if I was a governor, I would say, you know, nobody is going to come from another county to hold a rally in my county, because that's increasing spread of disease. This is a time to ensure that everybody in the county is wearing a mask, that we're reducing gatherings, that we're thinking about how best to make public transport safe, for example, so that we reduce the spread into the counties as well.
Is there anything you're seeing that is different today, Lois, compared to the first time when in March when we reported our first COVID-19 case? Have you seen any changes in the patients that are now coming in, or is it just the numbers that are coming in droves?
So the numbers are higher. We are seeing a few more older patients. We're also seeing a few more younger people. And it's probably just to do with the fact that we have a lot more community spread. So anyone who's living in the community is likely to come in with disease. When we start to see more of the older people, then of course, as I said before, we are concerned about severity of disease and how best to take care of these people. And maybe the appeal would be for, you know, anyone who knows they may be at risk for severe disease, you need to take a lot more precaution. Anyone who lives with someone who is at risk needs to protect that person as well. So that mainly things you're seeing. And one of the other things to mention, I know we are constantly talking about how older people are at higher risk, but the truth is we also see younger people who come with severe disease. So we cannot afford to be careless at any point. Each person really has to take precautions.
You know, Lois, even at this point, there's still people you meet on the streets there and they say, "Hakuna corona." What do you say to such people?
Yeah. I've had people ask me if I've ever seen a COVID patient when we've been managing patients with COVID since March. So I guess at this point, it's actually quite sad that someone should still think there's no COVID, because most people now know somebody who's been affected. You know, they've lost a friend, they've lost. We just need to open our eyes and look.
All right. Dr.
Figure out how to protect ourselves and our loved ones. So if anybody out there feels that there's no COVID, I can tell them for sure that there's COVID and that COVID can cause very severe disease. And we all have to take precaution. I have to take precaution. You have to take precaution. Everybody has to be careful. You
see, there's an extraordinary session coming up on Wednesday where the president will be meeting the county government chiefs. What kind of messaging would you like to hear from them, having been in the front line dealing with COVID-19?
So one, that COVID is real, and everybody has to take that message home. COVID is real. And two, we can prevent COVID. If you look at the initial stages of this outbreak, we had fairly low numbers. And these low numbers were because of the precautions that we were taking at that time. It wasn't by magic. The minute we lifted those precautions, we saw a significant rise in cases. And we have to realize that what happens depends on what we do. If we stop following all the precautions that have been put in place, we'll see an even bigger rise. For the president and the politicians, I really hope they will, one, take a critical look at themselves, because this is not the time to push politics at the expense of health. We will live another day to pursue politics and to pursue other interests. But at this time, let us think about the health of the country. So I really hope that even as they go into that meeting and leave, they will be thinking about how to reduce spread for everybody in the country, how to protect those who are vulnerable, and how to protect healthcare workers as well. Remember, the more cases we see in our hospitals, the higher the chance that healthcare workers also get infected. So we really have to think about how we reduce cases, how to protect the health workforce, and how to protect those who are vulnerable. And I hope that it will not just be lip service, that the things they say will actually be followed through.
Thank you so much, Dr. Lois. That's Dr. Lois Ombaji, Senior Lecturer at the University of Nairobi and also Infectious Diseases Specialist at KNH, speaking to us online on this issue of COVID-19. Listen, it all boils down to us as individuals. Keep your social distance, wear your mask.